than half of the sports injuries are overuse injuries, meaning they're preventable. It didn't have to happen. They're not traumatic injuries. So once you recognize what kind of things to look for, how to avoid them, a lot of these injuries can be prevented. Prevention, which is, I think, bigger, and this is why we're all here, is to prevent any overuse injuries. It's a fine balancing act between the training, which is stimulating the body, and the rest, so that the body could rebuild and get bigger and better. And nutrition. The body needs the building block to repair itself and make itself better. Growing adolescents need about 9.2 hours of sleep a day. I know there are no kids in high school that are sleeping that much. On average, they're sleeping about 6.5 hours. And just some word for parents. Observe body language, because the overuse injuries are very subtle and is insidious onset. They may not complain of pain right away, but their bodies may be telling you more than what they may be saying. So limping, weakness, stiffness, just by observing, you may notice something is not quite right, because you guys will know more than us will ever know just by talking to them 10, 15 minutes in the office. You know what your kids are like at baseline. So when something's not right, you're the ones that's going to have to pick them up. And I value the information from the parents a lot, especially mothers. Mothers can pick up anything. Looking for things that they're not really telling you with verbally, but looking for their body languages, their gestures, their facial expressions. You know your kids really well, and anything that is different than usual, it may be a very subtle thing, their walking pattern, their body movements. You'll pick up on it, and you may want to ask them about it in a non-threatening way. Because if they know that you're asking, are you having problems, they know that they may be excluded from sports and they may not tell you the right answers. So open it. Open-ended questions, and you also want to talk to the coaches and the athletic trainers. Have you noticed anything unusual about my kid? He's not behaving the same. Is he not performing well? And look for other cues. Resist the temptation to recreate your own past through your kid. That's probably the number one thing that I see that I haven't figured out how to really tell the parents to say it nicely. If you do, let me know.
So often parents think, oh, I'd love my kid to get a scholarship. And what they're really doing is they're reliving their childhood through their child and their childhood through their child, and that's success for them. And I happened to go through that with my daughter. You know, she was a basketball player, but you know, she wanted to make her own decisions. You know, even though I enjoyed watching her, it was her life, it's her activity, and sometimes you just have to back off. But the important thing is that they play and they have fun and they develop skills and they're safe and they wear proper equipment and they're supported.
The parents, they need to provide constant support regardless of the success, regardless of the level of skills, and regardless of the playing time. So one of the big things is not to get mad because they're not playing.
Preventing is much easier than recovering from a surgery. I like doing lots of surgeries, but it kills me to have to operate for a preventative injury. Traumatic injury, you know, accidents happen, so I'm there to take care of them. But some of these injuries are overuse injuries that failed conservative treatment. Only option is surgery. And then you think about, you know, this didn't need to happen. And then I have to operate. I don't take pleasure in doing that. So prevention. Get the pre-participation examination. Dr. Parker talked about that already. A lot of these are obvious. Warm up, stretch, hydrate properly, rotate playing different positions even if you're on the same team. Play the pitcher, play the outfielder to give different bodies different stresses at a time. Avoid all year-round training. Give yourself 2 months, 3 months off so that at least your body could catch up and rebuild. Avoid same sport, multiple team participation. So to get around this pitch counts in Little League, now the kids are playing in multiple teams. Their school team, their traveling team, and a local team, house team, and the teams don't talk to each other on every single day. On any given night, they're definitely under the pitch count. But guess what? they're playing 3 different games in a weekend. If you actually look at the total counts, if the teams actually talk to each other, this kid has pitched 3 times the allowed limit. So avoid multiple teams. Develop age-appropriate skills. Fastballs, curveballs, sliders, there are different ages that these capabilities should be coming into play to prevent overuse injuries. And you need to consult coaches and trainers for proper technique so they don't get into trouble. These are all preventable injuries if you follow. Proper equipment. Do not play through pain. Pain is there because the body is complaining to the brain. You need to take a look at me and find out why I'm hurting and take care of me. Dr. Parker has already talked about specialization, which leads to high-level, repetitive, year-round training, which causes burnout. Cross-train, participate in more than one sport. Communication among the athlete, the parents, coaches, and physicians like us are probably the most important thing.
I think it's important that they see a doctor every year. I do a lot of physicals at the school. It's not a great place to do them. I think you get very little contact with children at that point. It is kind of necessary because a lot of the kids don't have regular doctors. A lot of them won't come to doctors. But after doing thousands and thousands and thousands of them, I can't tell you how many I've done, I can do an excellent physical in 3 minutes. Now, I really can, and I'll tell you later why. But what we don't do is we don't have the setting to talk to them about stuff. So in the office, you talk to them about updating their immunizations, substance abuse, sexuality maybe, emotional concerns that they may have, and that's where the physical comes in, because that may be the only contact that a child has with a physician during the entire year. So it is important in the sense of contact with a physician. The Virginia High School League, at least locally, has been a big proponent of education. There are conferences constantly on sports medicine, and as I said, the American Academy of Pediatrics putting out a lot of periodicals for their pediatricians, because that's where you're seeing the kids coming up through the ranks. You want your doctors knowledgeable about injuries, and at least be able to refer them appropriately. So I think that in those areas we talked about, I think there's a lot of emphasis now, and we're refining the athlete now. We're ahead of the power curve. We're starting to anticipate things so we don't get kids with eating disorders and female athletes that are getting stress fractures and reducing their periods and overtraining, because we're seeing it way up front. And again, the cardiac issues are the other thing. So why let the children play? Because they're going to play one way or another. They're going to play in the sandlot, they're going to play in the street, or they're going to play on manicured turf. Whatever you want them to play, they're going to play. That's what we did, and that's what we want them to do. In sports medicine, we do not treat injuries like accidents, because they want to return to the same thing that injured them. And in general, many physicians are uncomfortable about returning a patient or returning a kid to an activity that they were injured in or was risky. You can't do that to kids. You can't say, oh, there was an orthopedic doctor in town who's now retired who if the kid dislocated his finger, he would say, that's kind of a sport you shouldn't play. And I think you have to kind of be reasonable about that. So keeping kids out because they get hurt is not the answer.